In this video, we will go over the chronic care management section in population health. This section allows you to document time spent on chronic care management and run reports to make tracking and billing easier. To access the chronic care module, from the main screen, click on the chronic care management option on the left. At the top of the page, you can see different quick reports. By selecting any of these reports, you'll display the patient list for that type of report. You have eligible population, prospects with upcoming appointments, enrolled patients, and to be reviewed. By default, the eligible population report will display. Any of the blue text can be selected for more options. Clicking on the patient's name, for example, will open up the patient details. From this screen, you can also set a provider for the patient and enroll them in CCM services. When you click to enroll them, you'll get a pop-up screen. In this screen, you can select the options for enrollment. Please remember that in order to enroll a patient in CCM, they must have given consent, either written or verbal, have a plan documented in the EHR, and have electronic access, like a patient portal, enabled. The prospects with upcoming visits is similar to the eligible population, but you can see patients that have a visit scheduled. This list is sorted by appointment date. You can select the provider and enroll patients from here as well. Once you enroll a patient, they get moved to the Enrolled Patients report. The Enrolled Patients report shows the patients you have marked as enrolled in CCM services. From here, you can manage the patient's enrollment status. Click the Manage option under the CCM Enrolled column. In here, you can mark if consent was given, if a plan was documented, and if electronic access was enabled. The To Be Reviewed screen is where the practice can log time spent on non-face-to-face time with the patients and view the time you have reviewed so far with that patient. This screen will show all the patients that have not had 20 minutes of non-face-to-face time documented. To document time, click on the Not Reviewed option under the CCM Review column. This will open up a pop-up window. On this screen, you can document the time and a quick summary of what was done. Click Add Review to add the time to the patient. Below, you will see the time recorded for that patient for that month. You can delete entries if you need. You can also change the month you are looking at by clicking the drop-down menu. Once a patient reaches 20 minutes of time, they will come off this report. To review all the patients for a given month, click CCM Reports. Here you have two options, Missed and Billing. The billing report will allow you to see all the patients you can bill for, including the time that was logged, what CPT code you can use, and what diagnosis code go along with those CPTs. The Missed report shows patients that did not reach the 20 minutes of time logged. It is best practice to review these reports often to manage CCM. If you have any questions or are looking for more individualized help, please reach out to your support entity today.